Most people develop an occasional sinus infection, ear infection, or bout of bronchitis. But if these infections keep coming back, especially if they occur several times a year, it may be a sign that something more is going on. As pulmonologists, we often evaluate patients who have recurrent sinopulmonary infections, meaning repeated infections involving the sinuses, ears, airways, or lungs. While exposure to viruses is common, frequent or severe infections deserve a closer look. Many patients with recurrent respiratory infections also have atopy, a tendency to develop allergic conditions such as seasonal allergies, hay fever, allergic rhinitis, eczema, and asthma. When allergies cause chronic inflammation of the nose and sinuses, normal drainage becomes impaired. Mucus accumulates, creating an environment where bacteria can grow. Similarly, inflammation in the lungs can make patients with asthma more susceptible to bronchitis and prolonged respiratory illnesses. It's important to recognize that uncontrolled allergies and asthma don't just cause symptoms, they can increase the risk of recurrent infections. Another possibility is an underlying immune deficiency. Our immune system produces antibodies, immunoglobulins, that help fight bacteria and viruses. Some people are born with deficiencies, while others develop them later in life. These conditions are often overlooked because patients may simply assume they always get sick. Some warning signs include multiple sinus infections each year, recurrent pneumonia, frequent bronchitis, ear infections in adults, infections requiring repeated courses of antibiotics, and poor response to routine treatments. One of the more common immune disorders seen in adults is common variable immunodeficiency, CVID, but there are several others, including selective antibody deficiencies and IgG subclass deficiencies. Repeated infections can sometimes damage the airways, leading to a condition called bronchiectasis. In bronchiectasis, the airways become permanently widened, making it harder to clear mucus. This can create a cycle of mucus retention, infection, inflammation, and further lung damage. Early recognition and treatment are important because appropriate management may slow disease progression and improve quality of life. When someone has frequent respiratory infections, we often perform a comprehensive evaluation that may include Number 1, a detailed medical history. Number 2, pulmonary function testing to evaluate for asthma. Number 3, allergy evaluation. We do this right in the office. 4, blood tests to measure immunoglobulin levels and antibody function. Number 5, Connecticut imaging when indicated. Number 6, sputum cultures if chronic mucus production is present. The goal is not simply to treat each infection, but to identify why the infections keep occurring. As always, treatment depends on the cause. The right treatment varies from patient to patient and may include better control of allergies, optimizing asthma therapy, vaccinations when appropriate, airway clearance techniques, treatment of chronic sinus disease, immunoglobulin replacement therapy for selected patients with significant antibody deficiencies, or preventive antibiotics in carefully selected individuals. Treating the underlying problem often reduces the number and severity of future infections. So, when should you see a specialist? You should discuss recurrent respiratory infections with your pulmonologist if you, number 1, have 2 or more episodes of pneumonia during your lifetime. Number 2, experience several sinus infections every year. Number 3, need frequent courses of antibiotics. 4, have asthma that remains difficult to control despite treatment. Number 5, produce chronic mucus or have a daily cough. Number 6, feel like you're always sick. These symptoms don't automatically mean you have an immune disorder, but they do warrant further evaluation. Frequent sinus and lung infections are not always simply bad luck. Allergies, asthma, chronic sinus disease, bronchiectasis, and immune deficiencies can all contribute to recurrent illness. The good news is that many of these conditions are treatable. Identifying the underlying cause can reduce infections, improve breathing, and help protect your lungs for years to come. If you or a loved one struggles with recurrent respiratory infections, talk with your pulmonary provider. Finding the reason behind repeated infections is the first step toward better health. If you would like to make an appointment with one of our providers to discuss any respiratory symptoms, we have 5 convenient locations in South Jersey and 1 in Maysville, Kentucky. Give our offices a call, or you can schedule your appointment online at medcoursusa.com.